So we're looking at the next discussion we should be having, and this is what is known as a toxic megacolon. So what is toxic megacolon? We'll discuss it. So of course, can you see how large the intestines here are? Alright, so this should give you an idea of what a toxic megacolon is. So just so you know, it's a life-threatening and it's a complication of colonic disease. That means you will not have toxic megacolon as a first disease. It's usually when you have diseases like what? Ulcerative colitis, okay, infectious colitis, ischemic colitis, you understand, and those disease conditions don't receive the best treatment, then it could actually lead to this adverse one. All right, so pathogenesis is usually due to severe inflammation of the colon. So mechanisms is inflammation extends into the muscularis propria, then the colon becomes dilated and atonic. So inflammatory mediators like cytokines, nitric oxide, impaired smooth muscle contraction, there's risks of perforation, okay, usually increase because the stomach wall is becoming thin and thin and thin. All right, so diagnostic features is acute colonic dilation, so usually more than 6 cm. Okay, then clinical criteria is if you do a radiography, you actually see it. Can you see how the bowels are actually so dilated and all of that? Then systemic issues, the person is having fever, tachycardia, leukocytosis, anemia, plus at least the person is dehydrated, altered sensations, then electrolyte imbalance, and also hypotensions. So clinical presentation is the severe abdominal pain and distension. It could lead to fever, tachycardia, hypotension, then diarrhea, which is often bloody. Okay, so complications could lead to perforations, lead to massive hemorrhage, okay, sepsis and shock. Then sometimes there's a risk of dying, because how can somebody even recover from something like this except it's treated ASAP? So management, we have to hospitalize the person, stabilize them with fluids. We give medication, that's antibiotics, if you're suspecting that there's infection related. Then avoid colonoscopy or barium enema, because if you touch the walls of the intestines, it could perforate. Okay, so surgery, you might actually want to remove some parts of the intestines.